Catherine, if you're ready.
Thank you so much, Jill. What we're going to do is talk about the phase of the public health emergency that we're in now, which is year 2 of the public health emergency, and the Appendix K allowances that are still in place, and what we predict for the future. So if you will move the slide forward, please. Thank you. The mission of the Department of Community Health is to provide access to affordable quality health care to all Georgians through effective planning, purchasing, and oversight. Next slide, please. Thank you. Now, let's talk about what we want to do today. We're going to furnish providers with the details about the Appendix K for the elderly and disabled and the independent care waiver programs. We're going to provide information on all the Appendix K amendments for all 4 of Georgia's waiver programs, with the realization that our sister agency, the Department of Behavioral Health and Developmental Disabilities, administers the day-to-day operations of the NOW waiver and the COMP waiver program. With that said, they can help you on the details of the Appendix K rollout, but we can give you a high-level overview because they pretty well mirror the other 2 waivers across the board. Next slide, please. And so, as you know, we have, I think you heard this morning, if you were in the opening discussion, that CMS has just extended the public health emergency by another 90 days. And so at this point, we know that we'll still remain under a federal public health emergency until mid-January. Beyond that, I think no one really knows at this point. It depends a good bit on what the virus does between now and then. But we know that we're still in the public health emergency through mid-January, and so that's what this presentation will really discuss. Next slide, please. So we'll first want to tell you just a brief summary of all of the Appendix K iterations and submissions that we have submitted to CMS, what's happened to them, and then those that have been approved is what we'll really focus on for year 2. And we're going to go through this slide presentation really quickly. It's going to look very familiar to you because there's not very much we changed going into year 2. There were a couple of important things that I did want to tell you about. So we'll go through these slides pretty quickly. Next slide, please. Thank you. So here's a summary, and I'm going to kind of start at the beginning and quickly review these. Every single Appendix K that we've submitted, we have grouped the waiver programs into 2 groupings. One is the new options waiver, the NOW waiver, and COMP. The other Appendix Ks that we've submitted have been on behalf of the elderly and disabled and the independent care waiver programs. So we've submitted 2 specifically. The purpose is, as in all Appendix K applications, is to try to mitigate the exposure risk of the COVID-19. It actually has allowed us to do things very differently in recognition of the public health emergency that we have all been going through now, and this is year 2. We had an effective start date that was approved by CMS as of March the 1st of 2020. We submitted another Appendix K amendment in June of that year to allow continuous retainer payments beyond the first 30 days. And CMS denied that and asked us to withdraw the proposed amendment. They denied it because they only allowed, as you all know, 90 full days of continuous retainer payments in the Appendix K process. We submitted another Appendix K amendment in June of that year, and we added a telehealth option to the now in comp Appendix K. Next slide, please. That was approved. If you could go to the next slide, please, ma'am. Thank you. We submitted two Appendix K applications to extend year one. And so we again submitted one for the now in comp programs and another for the elderly and disabled and independent care waiver programs. What that did is it gave us the authority to extend it into year two and for 6 months beyond the end of the public health emergency. That was approved by CMS. And the now comp change also provided an attempt. Go back one more, please, ma'am. Thank you so much. The now comp Appendix K provided an intent to increase the rates in certain specific services. And at the same time that we presented the year one Appendix K, we asked that the elderly and disabled and ICWP changes include an expanded definition for adult day health services. That was denied by CMS, but the now comp changes were approved. We recently submitted another Appendix K amendment to CMS on behalf of the elderly and disabled and the independent care waiver programs, and the purpose was to request an across-the-board 10% rate increase for all services in the elderly and disabled and the ICWP, and that remains under review by CMS since August the 12th of this year. It has not been approved yet. It's under review. Next slide, please. And so, again, the Appendix K in year two was extended to include another year plus up to 6 months following the end of the public health emergency. All along, CMS had advised us to ask for an additional 6 months so that we could, perhaps even on a one-by-one basis, begin to roll back to a state of normalcy following the end of the public health emergency. We have up to 6 months, but can roll back to the original policy requirements at any point, and the expectation is that we'll do those very gradually, just 1 or 2 at a time. Next slide, please. We, in year two of the PHE, the provider message, we posted a provider message on March the 1st about the CMS directive that the only modification that could not be extended around the Appendix K request was the use of retainer payments. That CMS had said at the time would not be sustained, would not be renewed. Excuse me, I'm in the office and the lights go out. Would not be reviewed, and so we did not even submit that. Next slide, please. You can see that we did not include retainer payments in the year two extension. Next slide, please. Thank you. All of the telehealth provisions are still in the Appendix K and still allowable. Next slide, please. Okay. We expanded the service settings, and I will say that while we still have the service settings expanded so that personal support services or CLS can be provided if an individual is hospitalized or has to receive acute care of some sort in an institution, that has not been widely used, and so we recognize that that's tough because many of the acute care hospitals wouldn't let your staff in for very good reason because it was for infection control reasons. So it has not been widely used. Next slide, please. We did and still have in place the allowance to temporarily exceed the service limitations. Now, this is going to apply to the now and comp waivers, where they have specific maximum unit caps for services in both the now and the comp waiver programs. As you know, in the elderly and disabled and in ICWP, we do not cap particular services. With a couple of exceptions, and I think there's a maximum of maybe 2 meals a day allowed in home delivered meals, but where it doesn't make sense, we don't cap individual services. So this only applies to the now and comp, but that's still in place. Next slide, please. There have been a lot of questions about reimbursement of family caregivers, and during this period, when it's been exceptionally difficult to find non-family caregiver staff, we have continued to reimburse family caregivers as if they were non-family hires by agencies. And so to that end, we're continuing to do that until the end of the public health emergency. We do know that at some point within that 6 months following the public health emergency, we'll roll that back. We don't know exactly how that will look. We will give lots of notice to providers when that's about to happen. But at this point, we are still reimbursing family caregivers to deliver care to their mom or their adult child or whomever that might be. The stipulations are still the same. You'll go through the hiring process for a sister or a brother or whoever that family member might be. You will need to get a criminal background check for that family member. You will also pay them on a regular payroll basis, the same hourly rate that you would pay any non-family caregiver. So it looks the same. With regard to training requirements, we did give you lots of leeway in the training of family caregivers. And we specified that it be directed as needed to those areas where family caregivers may need some supportive supervision and training. So for example, if this is a brand new family member who has not transferred a member in the past, a family member who, let's say mom requires transfers, but that was always provided by a different family member or by a paid staff member, then that family caregiver would need to be trained in the specifics of safe transfer techniques. But otherwise, if your staff can confirm, your supervisory staff can confirm that the family caregiver has been performing the task adequately or has been trained in the task, that's perfectly fine. You don't need to go through that. We would ask, though, that you document that you have inquired, you have interviewed the proposed family caregiver to make absolutely sure that he or she already has those skills. Next slide, please. Modifying the provider qualifications. We again modified the training requirements, and that is still in place until the end of the public health emergency and perhaps a little longer. Inexperienced staff is still going to be required to participate in training, and it can be electronic training. That's perfectly fine through an iPhone or whatever means you want to use. Next slide, please. Thank you. Many case management agencies have already begun to resume face-to-face contact because many case managers realize that after nearly 2 years of not seeing face-to-face the member that they are to advocate for, provide and arrange services for, that's just too long for them to really understand or have a relationship with that person, understand what might be going on in the home. And so many case managers have already begun to resume face-to-face contact. If they have not, or if there is a request by the family that they not do that because of exposure precautions or fears, that's perfectly fine because this will remain in effect until the end of the public health emergency. And then we'll roll it back into a state of normal. Next slide, please. Thank you. We have increased payment rates temporarily under an Appendix K for in the now and comp for support coordination, residential services, community living support, which for those of you who work in the elderly and disabled or ICWP, that's the same thing as personal support services, and community access, which is very similar to adult day health care. It's a group setting, though can be delivered individually. Those payment rates were increased in the elderly and disabled waiver and all four waivers, as a matter of fact. Financial management services for people who self-direct their care were increased to $95 a month. In the ICWP and now in comp, where hourly nursing services are available through those three waiver programs, LPN rate, reimbursement rate, was temporarily increased to $10 a unit. Next slide, please. Thank you. This is about the acute care hospital stay. If the institution lacks appropriate staffing as a result of the health emergency, these services can be delivered in an acute care hospital setting. They have to be delivered consistent with the plan of care. So if, for example, your plan of care was designed to provide services to a person 3 days a week for the purpose of bathing and assistance with dressing, etc., your staff can go into the hospital if they're allowed because of precautions, infection precautions. If they're allowed, your staff can go into the institution and help that staff provide the care for the duration of the PHE. Next slide, please. Retainer payments are gone for year 2. Next slide, please. Thank you. And then we're still posting information as it occurs. Of course, the Department of Public Health is your go-to agency for general information about COVID-19 and specific information about COVID-19. For information about vaccination, it's also found on the Department of Public Health website. Please do continue to monitor provider messages, because if the state of public health emergency were to be discontinued, we're going to post messages to you very quickly to let you know what's upcoming. But we'll do that through the provider messages portal. If you're a member of a provider association, we're also contacting the provider associations specifically to help us broadcast messages. But the only way that we really have to communicate with providers well is through the provider message portal. Please do make absolutely sure also that your email address is correct in the MMIS system, because we will very likely occasionally need to go into the system and fetch your email address, your contact information from there. So please don't forget to update your contact information if something has changed. I think that might be the last slide. If you could click to the next one, just in case. Thank you. This is just a thank you slide. We had a couple of questions that were submitted in advance of the Appendix K. One in particular was about the family caregiver. And I think I did answer that already, that we are still allowing the employment of family members as paid caregivers by agencies. And so if that's the best solution for continuing the care of the member, please feel free to do that until you receive further notice through a banner message, through a provider message in the system. Shall we open it up to questions and answers? Jill, I'm not sure if we have questions in the box.
Okay, we do have questions in the box. Kaylee, did you want to address those?
Yes, ma'am, Ms. Catherine. We have two questions. The first one states, can providers bill the personal retainer the 30-day limit at this point if a person is supported on a vacation with family or other reasons?
That particular question, I want to just let everybody know, it is specific to the Now and Comp waiver programs. The Now and Comp waiver programs allow a personal care provider, which is called CLS, to bill for a personal retainer assistant. And that is just, it's a nod toward being able to retain a person's selected attendant while that person might be away for a while. And the answer to that question is yes. The personal assistance retainer is actually a separate issue from the retainer payments. The retainer payments were directed primarily in year one to that attention that was given to individuals who could not receive services.
Okay, awesome. And the second question we have is, when the wage increase is approved by CMS, will there be paid retro?
As of the date that CMS approves it, we always increase it retroactively. And so if the rate increase is approved today, and the date of approval was actually backdated to July the 1st, then we would retroactively pay that rate increase back to July the 1st.
At this time, we have one more question.
Okay.
When is a public health emergency end date?
We don't know that any more than anybody does. I think that's being determined. In fact, it is being determined by the Centers for Medicare and Medicaid Services on a quarter-by-quarter basis. And it depends quite a bit on the activity of the virus at that particular time. In fact, that is how the decision is made, is they look at statistical determinations of how of the prevalence of the virus in any spot at any given time, and they make those decisions on a quarter-by-quarter basis. So we're as up in the air as you all are about that.
Okay, at this time, other questions? Would you like to allow some more time to give them opportunity to ask?
Maybe about 5 more minutes, since we've got about 20 minutes left.
And I did unmute everyone, but the participant will have to go in and unmute themselves so they are allowed to speak out and ask a question if anyone has any additional questions.
Thank you, Jill.
And please do remember, while we're giving it a little bit of time, these questions will be on our website in a Q&A in case you missed the answer or didn't hear the answer or need to document the answer. They'll be available in about 10 working days.
Okay, we have one more that comes in. When do we expect the race increase to be approved by CMS?
I wish we could predict that. We submitted it the 12th of August, and we just have not gotten a response from CMS. I did have a most recent response from CMS when I inquired about what we might do to move it forward. And my response from CMS was that it was still under review. And so we're not quite sure exactly when it might be approved. The Appendix K was submitted specifically for the elderly and disabled and the ICWP programs, and that will allow us to go back to a requested date of July the 1st, which responds to the previous question about retroactive increases. As soon as it's approved, because of the request date that we submitted, we should be able to go back to July the 1st.
Thank you, Catherine. At this point, we've waited about 3 or 4 minutes. If you do have a question, please speak up now.
There is one more question that came in the chat box here. It says, is there anything we can do as a provider to lobby approval? I'm assuming of the rate increase.
I'm assuming of the rate increase also. I don't know of anything. We'll continue to press CMS for a decision one way or the other. But I don't know anything that individual providers can do. I would stay in contact with your provider associations that you're affiliated with and make absolutely sure that they have the latest information, which at this point is not much. And I'm sorry about that, but we just don't know.
And can I just add in there a minute to keep up with the latest updates? Hopefully all providers know to check their banner messages, because that is how DCH will let all providers know of any changes or increases, anything of that nature. Everything usually, most of the time, comes out in a banner message. So please try to check those on a regular basis.
Thank you, Jill, for that reminder. It's really our best way to communicate with providers. That said, we also provide professional association information, email information to Gainwell, and Gainwell sends out email blasts. But the best way and fastest way for you all to have information is to check your provider messages routinely every week. Thank you all so much. I don't think there are any more questions at this point, unless that's not correct. Okay.
No more questions, Ms. Catherine.
Thank you all very much.
Thank you, Catherine. Thank you, Kaylin. We look forward to our next health fair and hope everybody will participate.
Thanks, Jill and Kaylin.
Thank you.
Thank you.